Hello, my name is Dr. Bob Bollinger, Professor of Infectious Diseases at Johns Hopkins University School of Medicine. I'm also the Director of the Johns Hopkins Center for Clinical Global Health Education and a member of the Faculty Steering Committee for the Johns Hopkins India Institute. Patients with a positive test, for the most part, in fact, 80% of people with a positive test for this virus will do just fine and have very mild or even no symptoms at all. Only about 20% of people who have this infection will actually feel ill. The majority of them, in fact, will also recover quite well. So you want to be monitoring for symptoms, particularly symptoms that affect your breathing. One of the things that your doctor might recommend to determine whether it's okay for you to go home is to check your ability to breathe. And sometimes they use what's called a pulse oximeter, which measures the blood concentration. It just clips on your finger like this. And there are many different types of this. This might be important to check in people who are older, as I said, who are at higher risk for more severe disease. As you can see from mine, it checks, I don't know if you can see this, but it's got two numbers on there. One of those at the top says 98, and the other says 59. 98 is the percentage of oxygen in my blood, so anything over 94% is very good. And the number on the bottom is my heart rate, and so my heart rate is fine. If your heart rate is elevated or your oxygen level is low, your doctor may suggest that you stay in the hospital, but otherwise it's perfectly fine for you to go home. The distinction between mild, moderate, and severe disease generally has to do with whether or not they're having difficulty with getting oxygen levels, maintaining oxygen levels in their blood. And that's why the doctor is going to measure not only your oxygen level, but how frequently you have to breathe, or whether you're having shortness of breath. So people that have a normal oxygen level, that are not having difficulty with their breathing, and not having other severe symptoms, are what are called mild COVID infections. And those are the people that can be cared for generally at home. If you're having some difficulty with breathing and require some oxygen, that's often called moderate disease. And those patients are typically cared for in the hospital. Severe disease would be someone who has very, very low oxygen levels and requires higher levels of treatment, particularly in an ICU, or maybe if it's available, a ventilator. Normally, your oxygen level should be 94% or above. People with more moderate disease generally have oxygen levels between 90 and 93. Certainly below 90 or even below 92 sometimes is an indication of more severe disease.